everyone, and welcome once again to my Sunday 9 p.m. live video. Okay, today is the second topic on this series of sexual health. But before I start with my talk, I just want to talk about the rest of the videos that I have already. Actually, when it comes to sexual health, I have already a series of videos that are all uploaded in my YouTube channel. So I have painful sex, I had painful sex after menopause, sexual issues for women after menopause, as well as painful sex. And today I'm going to talk about one more topic about sex, which is why can't I have sex? This topic, many women may not even realize that this is a reality. There are some women out there who can never have sex. It's not that they don't want, they will be trying year after year and they just can't do it. Longest record was like 15 years of marriage. Married for 15 years and never had a single sexual intercourse. They just can't do it. So why these women, despite married, they can't do it? And as I said, these things is something that many women don't realize it. So I would appreciate if all of you were to share this video to all your friends. I'm sure someone would have this problem because it is actually a real problem, and the problem is nobody talks about it. How are you going to just tell your colleague, I've been married, we've been trying, but we can't? Everybody very scared to tell or very scared to ask because they worry that other people will laugh at them. Help your friends, do your friends a favor, share this live video, yeah? Okay, so I have a few scenarios for you. Case 1, married for 1 month, 2 months, can't have sex, so they come to see a gynae. So that is one way. Second scenario is they've been married for ages, 3 years, 5 years, and sometimes the wives have been given an ultimatum by the husband, which is, if we still cannot have sex, we may have to divorce, I may have to leave you, I may have to find someone else. This is a reality. The other scenario, they can have sex all these years. In fact, I have few cases like that. One, she's married and she has 2 kids. And she just can't have sex anymore after her second child. Just can't. No matter what they do, she just can't. They've already given birth for more than 2 years and they still cannot have sex after 2 years from the last childbirth. Why? These situations are usually due to only two possible reasons. In most instances, the woman actually finds it very painful, and that is why she cannot go on with it. But in some cases, it's not. They never even allow the husband to even go near them. It's like when the husband always attempt and they will just push the husband away. When the husband try to have sex, they just push the husband away. Some women, they allow their husband to come in, but because the pain was so bad, some husbands can't make themselves do it, so they just stop doing it and they just hold back. Because it's quite scary, if you really love your wife and your wife is in so much pain, I'm sure most men would not force it on the wife. So there are two situations that causes this. Situation number 1 is some physical thing obstructing. That is really possible. I have seen cases whereby there is a band across the vagina. So let's say this is a vagina hole and there's actually a band across it. A band like this. So every time the husband wants to penetrate, he just can't get in because there's a band across. It can happen as congenital. That means the lady is actually born with it. It's just that she doesn't know because she never had sex all this while. It is not a total block. It is just a band. So there's still holes here and there for the menstrual blood to come out. So there is no total obstruction, but it is just a band. So, but when they want to have sex, they just can't do it. It can also be due to childbirth. Because after you give birth, there's always a wound. And then when there's a wound, we always stitch. But you must understand, there are some women who don't stitch. In fact, if you think about women like 100 years ago when they give birth at home, they don't usually stitch. And if you think about even nowadays, there are still women who will say, I do not want to stitch. And I also know certain hospitals overseas, especially in the Western countries, who don't routinely stitch back. Okay, think about it. Why they don't stitch? Aren't they worried about the wound not healing? No, they are not worried because we know that if I have a wound on this side and I have a wound on this side, if I put it together, it will heal. What is the purpose of stitching? Stitching is to make sure 2 sides of the wound meet each other. So 2 sides of the wound meet each other, it will heal. So if women do not stitch like 100 years ago or 200 years ago when they used to give birth at home, Will there be a problem with this healing? No. Why? Because you have a wound, and if you know our private part, as long as we keep our legs closed, it's always closed. So it's always closed, it always meet up, and it will heal. So in most situations, even if you don't stitch, but because it meet together, it will heal. That is why there is this cultural beliefs that I still hear people telling me that their mom told them, confinement, you cannot open your leg big, you must always keep your legs closed. So if you think about it, nowadays if you are all stitched up already, actually it doesn't really matter how you put your leg. But if you're thinking about women those days when they used to give birth at home, then yes, because they never stitch. So you need to keep your legs closed so everything is together. So when two wounds meet each other, they will heal. But unfortunately, childbirth wound is not a surgical wound. In the sense that it doesn't only tear, it doesn't only have a small cut. When you operate, it's always a nice line open up. So it's the same like if you have an episiotomy after childbirth, it's also a nice line that we cut that open up. So we stitch it up, everything nicely. And when you cut an episiotomy, you have to stitch because episiotomy is diagonal, it's not straight down. But when you have a natural tear, it's usually straight down. But the thing with childbirth is it's not just this wound, it's not just the episiotomy that you had. They like to tear a lot of other places. They like to tear in different areas. And when you have different areas that are torn, and if you close your leg and they meet up, they will also form a wound that will heal across left and right. So when you have that, so this is what happened. You will actually, you have an episiotomy, you probably have a wound down there, and you have your vagina hole here. But unfortunately, you may have some wound also here and here. And because you close your leg, it meets up together, these two parts, it meets up together, and it will heal. And so at the end, you will also have a band across your vagina after your childbirth. So in this situation, because of the band that heal across either the one that you're born with, or it happened because of childbirth, you can never have sex because it can never go in. But having said that, this is a very rare situation. It is very rare. Whether congenital or as a result of childbirth, it is very rare. And the solution is very simple, just cut it off. But in order to do that, you need to come and see a gynae to let us assess to see whether there is actually a band across. So this is the first reason why women cannot have sex, but it is a very easy, solvable problem. Then there's another second reason. The second reason for why women cannot have sex, it is not due to a band, and in fact, physically they are totally well. They're totally well, irrespective of scenarios where after marriage they can never have sex, or scenarios where they can have sex all along, they have been having sex all along, but after childbirth they cannot have sex. I have cases where after childbirth they cannot have sex, but I can put my finger in, I can do a pap smear, but they just cannot have sex. So why? Physically there's no problem with them. Especially if you think about those who are after childbirth, very often, I not just can put a finger in them, I still find that it's very roomy. There's like a lot of space in their vagina for them to have sex. It's not even tight, it's quite loose, but yet they cannot have sex. So why is it that some women cannot have sex? Even though there's no problem with them, it is very often due to fear. Fear of something. Some women, they are so scared of sex for all sorts of reasons. So the degree of fear is different. Everyone is different. Those who are so scared, they won't even let the husband go near them. The moment the husband come nearer, they push away. The moment the husband come nearer, they push away. So they push the husband away and they just won't let the husband have sex. And I know these women because in the clinic, if you try and examine them, they don't just scream. They will literally climb up on my bed and they'll be standing on my bed. They just won't let me touch them. So they're very scared. So the first group of women, they're just very scared. They won't even let you go near them. Some not too scared. Maybe they will try to have, but it's so painful they just can't go on. Or it's so painful and the husband look at the wife, you're in so much pain, I cannot be doing this. So they can't have sex because the wife is in a lot of pain. And there are some women who are slightly better. They can actually have sex, but they are still in a lot of pain. And all these actually, they are just different stages of fear, but it is all due to fear. And the fear can be all sorts. It can be due to past bad experiences like rape, molest. It can be due to some other trauma. In the past, I have seen one girl. All she had was because when she was young, I still remember this girl, when she was 8 years old, she had an accident. And the accident was so bad, it was a head injury. So she actually admitted to ICU. She was staying in ICU for 1 month. So what happens in that type of scenario, when you're in ICU and you're not really fully conscious, what happens is that when you pass urine, you can't pass urine on your own. So we usually put in a tube. So you have a urine bag. When she had the accident, she was not conscious. When she was partially being awakened back because they reduced the medication, so she's half awake and half asleep, she's seen nurses putting, the urine tube inside her. They want to put in the tube to drain the urine. But poor girl, she's 8 years old. She doesn't know what's happening. She was struggling and screaming. Sometimes in that type of state of mind, sometimes they are not really struggling from what we see from outside, but in their mind, they could know what is happening and they're really struggling. So it was a very traumatic event for her. And that's why she cannot have sex. Because having sex is to put something in from below, and she's so traumatized by it. Okay? Nobody raped her. We were putting a urine tube. But it was a very, very bad traumatic experience for her. So the trauma is due to different reasons. I also had one, a fall. Children, bicycle, they like to ride bicycle, and then they ride, and they fall down. And they fall, they have a tear at their private part. When you then bleed, and parents rush them to the hospital, and doctors examine them at their private part, and it's so painful. And then later we stitch them and things like that. It's just so painful. So this type of experience also can cause fear. But this is own life experience. But there are many that don't have own life experience. I had another very interesting case. She had this trauma when these cases usually, I will send them to my counselor. And my counselor will explore. Fear. Why fear? Why fear? And when we send, it was a very interesting story. It was a movie. Now we understand. When movies is 13 means it's 13, is 18 is 18. Yeah? But a lot of children, they just watch the show even though it's 18, right? So in this case, she saw a movie. It is a Malay movie of Masuri. We all know Masuri, right? The legend of Masuri. So Masuri's death is whereby they use a spear, pierce her from her vagina upwards. That is how they kill women, so-called adultery or having affair in the past. They put the spear from the vagina upwards, and that traumatized this little girl when she was so young, when she saw the movie. And now she's married, she just can't have sex. I had also another case. She's a reporter. And what happens with her as a reporter is that she dwelled into one of the cases that we had long ago. There was this young girl who was kidnapped and raped and murdered. She was covering that case before she got married. She went in depth, she went to see everything. It was so scary for her. And she couldn't have sex. It's not her life experience. Nothing happened to her. Just like the one who saw a movie on Masuri, nothing happened to her. So everyone has a fear from different reasons. And I also have cases. I have this one case that I like to share. It's because she already have 2 kids. She already have 2 kids. And she could not even have sex after her second kid. And why is that she cannot have sex after the second kid? It's all because of that particular childbirth. You can have birth trauma. You can have birth trauma and you have post-traumatic stress disorder. It's a birth trauma. And they just can't have sex. So you see, there are people with birth trauma that just don't want to get pregnant anymore. There are people who after birth trauma have difficulty getting pregnant, but they can still have sex. There are people who have birth trauma and they can get pregnant, but they keep having miscarriages. And there are people with birth trauma that just cannot have sex. So we never underestimate birth trauma. Never underestimate. So I have women, because of birth trauma, they can never have sex after that. They can have sex all along. And when I examine them, there's no problem. They just had birth, especially natural birth, and it's all out. Down there, it's a bit roomy already. There's so much space. There's no reason why the husband cannot go in. But because the trauma is so bad, they just can't. So, psychological reason for women who cannot have sex, it's real. And it's real. And what is the reason why they cannot have? Of course, the very, very bad one will push the husband away, no need to talk. But the other group, they just have a lot of pain. Why do they have a lot of pain? It's because number one, when you're scared of having sex. When we want to have sex, when we don't want the pain, in order not to have painful sex, we need to be moist and wet down there at our private part so that it lubricates the action of sex. So that when the penis goes in, it's not painful because it's lubricated. But in order for that to happen, mentally you must be in. You must be mentally into the mood, enjoying yourself, enjoying your foreplay. But with women who fear about sex, how to have the mood? More often than not, they're just trying to do it. It's like, I need to do it, I'm married. If I don't do it, maybe my husband don't want me. or something will happen, or I've never had sex, I really want to try it, why can't I do this, It's just something that every woman can do. Why can't I do it? So there are a lot of reasons why they force themselves to do it. But if you're not into it, you just can't do it. The mood is not there. It is going to be very painful. And if it's very painful, then you will stop. That is one reason. Second reason, when you're very scared of having sex, the muscles around your vagina actually squeeze very tight, very tight. So if anyone is trying to go in, it is like forced to go in, So it's very tight. So that is why they have very, very painful sex. So these are the two reasons why they're they're in a lot of pain. So the degree of pain, everyone is different. Ability to tolerate pain, everyone is different. That is why some women just find it painful, but they still can do it. Some women, they can't do it at all. They keep trying, but they can't do it. And some is just like far, far away. They push them away, push the husband away. They can't see doctor also. They are standing on my table, standing on my examination bed, and no way, she's just going to run away. Okay, so that is why these women actually, it's quite pitiful actually. But we can help them. It is a solvable problem. It's a solvable problem. In my clinic, I have already set up this team. It is a team approach. I've already set up the team. I send them for training. I guide them the first few years, and now they're very independent and they're very good. What team? In this situation, we have to measure, we have to do two things. We have to increase physical tasks for these women while reducing their fear for sex. So they actually see two therapists. One, physical therapist, which is a physiotherapist, and one is to for them to get rid of the fear, or for them to overcome their fear, which is a psychological therapist. So they have two therapists. So usually we work together, they work together, one bringing out the fear and one increasing the physical task. We use dilators, one of the things we use. But we cannot straight away give them dilator. If their fear level is so high, no dilator is going to enter. They're so scared even to enter the dilator. So we have to bring down so we educate them on their body, their vaginal opening, their hymen. We give them dilators, we give them things to do, and we slowly help them to loosen up that vaginal tightening. Because if you're always tightening your vaginal muscle, over time it is also very constricted, so we need to dilate it. We have to help her to learn to relax the muscles of the vagina. So there are a lot of things that we do. The entire program takes them about 4 sessions only, and after 4 sessions, most of them are able to have sex. So this is something that is solvable, but the problem is many of these women suffer in silence because they're not aware. So why I have this video is because when I actually Google this question is actually quite a common question in Google. So these women, the only place they go is Google. So that's why I decided to do this video, because I'm sure some of your friends are having this problem. As I earlier mentioned, this will be a series of sexual related videos. I have last week, we talked about teenagers and sex, and yes, it was shared to many places. A lot of you are sharing. Very, very thank you to all of you. And then before this, in the past, if you want to see the other videos related to sex, I have a painful sex video on painful sex. I have sexual issues for menopausal, so you can also go and see that. Alright, so I also have a video on birth trauma, and please go and see birth trauma, because birth trauma is real and it is quite common actually. All these videos are all in my YouTube channel, Dr. Tan City Clinic. Yeah, please subscribe to my YouTube channel. Please like my video and turn on the notification button. Yeah. Alright, so see you then. Thank you and bye bye.